So here we are discussing basically the anxiety disorders over here in this section. Basically, it's a psychiatric condition in which the patient suffers from extreme worry and extreme fear that is basically hindering the person's day-to-day activities. So when we are considering the day-to-day activities in a person's life, it's basically, it can relate to the sleep disorders of that person, it can relate to the eating habituals of that person, and as well as the relationship history when it is taken from such an individual who is suffering from an anxiety disorder, that relationship history would also be suffering due to these anxiety disorders. So history taking, as I've already emphasized, working as a psychiatrist, working as a practicing clinician, you should know how to take the history in details whenever you have these psychiatric disorders on hand, because these relationship histories, these past histories, personal histories, drug histories, of course, if the person, you are suspicious that the person is misusing some kind of a drug, which can cause or which can result in this anxiety disorder. So the substance history or the drug history is again very important to be taken in detail. Again, the corroborative history, which is taken from the relatives or the close friends, is again very important over here, and that is going to highlight if the person was already prone to such kind of a disorder, he had a borderline personality. So that will again emphasize on the fact that the person is suffering from an anxiety disorder, usually a term which is basically abbreviated as GAD. This abbreviation basically stands for the Generalized Anxiety Disorders. So this is all. We'll just give an introduction to the anxiety disorders over here. The problematic anxiety is what we should worry about in a person. Obviously, the normal anxiety response or a normal panic response is quite normal for an individual if it depends upon the circumstances. But if the circumstances are not leading to any anxious states, but the person still feels that he's anxious all the time, and he has the physical factors as well. For example, he starts sweating, he starts trembling. All of these physical effects are hindering his day-to-day activities. Then it is basically termed as an anxiety disorder in that individual. So the features of the state of anxiety will be discussed over here in this section in detail. Again, the history taking is very important. You'll basically highlight what are the features of anxiety. It can be the tremors, the shakes, the loss of confidence, the loss of eye contact. All of these will basically regard towards the anxiety disorder or the panic disorder in a particular individual. The endocrine disorders can again result in the anxiety or an anxious state in a particular individual. So we'll be discussing all of this. It's basically an introduction towards the term anxiety that we use very commonly. So anxiety disorders are very common and we usually come across them. So this is basically the classification that we usually involve while we are treating the patients, while we are clinically managing the patients. The neurotic, they're usually neurotic, stress-related and somatoform disorders. So the F40 category is basically the phobic anxiety disorders. So the person has a particular kind of phobia. It can be towards anything. It can be an agoraphobia, that is basically the fear of closed spaces. So all of this is basically will be included, all of these phobias related anxiety will be included in the F40 category. Moving on, in the F41, we'll have the other anxiety disorders. In the F42, we'll have the OCD, also known as the obsessive-compulsive disorders. F43 is basically the reactions to severe stress and adjustment disorders. F44 is basically the dissociative or the conversion disorders. And then we have the F45, which basically comprises of the somatoform disorders, in which the person is suffering from some kind of the physical ailment as well, along with the anxiety disorders. So in the F48 is basically a category which is involving the other neurotic disorders that will be categorized in this F48 category. So this is basically the classification for the anxiety disorders that we are focusing on over here. So when we define anxiety, it is basically a mental state that is characterized by the physical as well as the psychological symptoms as well. It is faced when the stressful situations appear in a person's life. The normal and adaptive anxiety is quite normal in a particular individual, and we do not categorize it to be pathological in that individual. Normal anxiety we usually experience in our day-to-day life and is a response to a known problem. So a certain kind of circumstances arise in a person's life, and due to that difficult situation, the person basically becomes anxious or he panics. So that is basically a normal reaction, a normal psychological reaction, and it is considered to be normal, not pathological, and it doesn't need any intervention or any medication. It is definable, and the external threat is always present in a normal anxiety if a person is going through a normal anxiety. Now, when do we call this anxiety as problematic? Abnormal, pathologically, or clinically, if it is extreme, if it is of an extreme level, even if there is a problem in someone's life, the anxiety should not be of an extreme level that it is hindering the person's day-to-day life. So the sense of fear is not well defined in this problematic anxiety. There is a misplaced anxiety. Sometimes the situations are quite favorable in a person's life, but still he feels anxious all the time. Not confined to the recognized stressful situations and the high-trait anxiety or anxious personality, borderline personality. Sometimes when you would take the corroborative history, it would reveal that the person had this basically borderline personality, and he was usually found to be anxious in a lot of cases. Internal threats are usually present over there. Reassurance is all that they need. Sometimes it is rarely effective, but still you have to use this reassurance as a treatment modality. The features of the state of anxiety are the mood is basically fearful, and they feel apprehensive all the time that something bad is going to happen. The thoughts are usually pessimistic. The themes of misfortune are there. The concerned will not be able to cope with the stress, and the unrealistic ideas of danger will be there. When you'll be taking the history, you'll get to dig out all of these thoughts in that particular individual. Then the arousal. There will be an increased arousal. The person would be alert all the time. There will be hypervigilance, restlessness, along with poor sleep. He'd be giving you a history of sleep disturbance, and there will be poor concentration as well. The behavior, reduced purposeful activity, increased purposeless activity, any activity which is not needed, any fidgeting kind of a criteria would be present in that particular individual, avoidance of some situations. So that is basically the generalized behavior in an anxious individual. And then the somatic will basically, if we physically examine such individuals, we'll note down the palpitations, hyperventilation, lightheadedness, and the person will be suffering from numbness or tingling, retrosternal constriction, that is behind the sternum, there'll be a constrictive force acting, increased muscle tension would be observed. Chest pain, the person would usually give you the history himself that he's suffering from chest pain, nausea, diarrhea, sweating and tremors and headaches would be found, dry mouth, and depersonalization. So all of these would be the physical factors present in such an individual. The associated symptoms would be a low mood and the high prevalence of irritability along with it. Secondary features are the other psychiatric illnesses. So depression, dementia, psychotic disorders, and physical conditions, all of these will be present along with anxiety in this particular individual. Then when we talk about the endocrine disorders, it can be the thyrotoxicosis, hyperparathyroidism, carcinoid syndrome, Cushing's disease, pheochromocytomas, pituitary disorders, and hypoglycemias. So all of these endocrine disorders have to be taken into account whenever we are looking at an anxious patient along with it. The other conditions to look for are the cardiovascular conditions, including the hypoxia or the congestive heart failure, pulmonary embolism, hypertension, angina or myocardial infarction, arrhythmias and mitral valve prolapse, The neurological conditions to consider in such a situation are the seizures, and the respiratory conditions include the obstructive diseases of the lung and the asthmatic conditions. So all of these conditions can again result in an anxious person. So this was basically an introduction, a brief introduction towards the anxiety disorders and what are the other factors rather than psychiatric factors whenever we are looking towards a generalized anxiety disorder. So that is the end to this section. Thank you for watching sqadia.com.